Yesterday, at UFC 252, rising MMA superstar Sean O'Malley unfortunately suffered an injury in round 1 of his highly anticipated fight with Marlon Chito Vera. The injury is likely a combination of things, including past injuries and Chito's leg kicks. We can see Chito land a hard outside leg kick at the distal lateral aspect of O'Malley's right thigh. After that, he appears to misstep several times. The kick struck the outside of his distal thigh, which is where the peroneal nerve runs. The peroneal nerve innervates many of the anterior lower leg muscles, namely the tibialis anterior, which originates from the proximal tibia and inserts at the medial and plantar surface of the first cuneiform and first metatarsal base. The primary function is to dorsiflex the ankle. This function is crucial for walking. As you can see here, particularly in the late swing phase, the foot tries to raise or dorsiflex in preparation for a heel strike. Those injured will compensate in a variety of ways, including waddling, swinging out, or doing a high steppage gait, which means exaggerating thigh flexion in order to clear the foot. While the traumatic injury around the knee likely was the culprit, an injury to any part of the upstream or downstream aspects of the peroneal nerve could lead to foot drop. One of his missteps clearly appeared to acutely worsen things, and may have sustained additional ligamentous injury in his ankle or foot. We know that Sugar Sean has had a devastating foot injury in the past, namely against his fight with Andre Soukamouth in 2018. In round 3 of that fight, you can see O'Malley instantly hop on one leg after landing a right kick to the head, and maybe landing poorly. According to this article, the injury he suffered was a LisFranc injury. Now, what the heck is a LisFranc injury? Well, the LisFranc injury is named after the joint it affects. The foot is segmented into the forefoot, midfoot, and hindfoot. The LisFranc joint complex joins the midfoot with the forefoot, whereas the Chopart joint joins the hindfoot and midfoot. Additionally, the midfoot is divided into medial, middle, and lateral columns. The medial column includes the first tarsal-metatarsal joint, the middle column, the second and third, and the lateral, the fourth and fifth. The LisFranc ligament is compromised, and this is the interosseous ligament spanning the medial cuneiform to the second metatarsal base. Essentially, this row of midfoot bones acts like an arch. More specifically, the second cuneiform acts as the keystone for an arch, and when it's damaged, this is when a LisFranc injury happens. A LisFranc injury is a tarsal-metatarsal fracture dislocation due to disruption between these bones. There are 2 main mechanisms. The lesser common one is a direct force to the LisFranc joint, causing either plantar or dorsal disruption, depending on where the force was. The more common indirect mechanism involves axial load or rotational force through a hyperplantar flexed forefoot, which is then transmitted to the LisFranc joint. The metatarsals are displaced in a dorsal lateral direction because those ligaments are weaker. These are some other examples of the mechanism in football, urgent car braking, or misstepping. The origin of the term actually comes from the surgeon LisFranc, who served under Napoleon. He described amputating this joint for soldiers who fell from a horse with their foot caught in a horse stirrup and developing gangrene. The injury can be associated with fractures of the adjacent bones, like these flecks of bone here. And not surprisingly, injured individuals will have severe foot pain with inability to bear weight. Bruising, swelling, and tenderness right at that area are common. If it's only a sprain, sometimes casting and non-weight bearing is only done, but usually this injury is unstable and requires surgical fixation or arthrodesis, meaning a fusion of the joint. Now, it's unclear if Sugar Sean resustained a similar LisFranc injury or developed a different one. Nevertheless, we will stay tuned for news from his team and hope he has a speedy recovery. Congrats to Chito on his victory. Please click subscribe for more awesome anatomy videos.